Everyone's worried about the flu this winter, but there's a more common illness that's making a lot of people miserable. Dr. Steve Salvatore looks at some new ways to treat sinusitis.
Nearly 40 million Americans suffer from sinusitis, an infection of the sinuses that can be difficult to treat. Sinus infections occur all year round, and many people are really feeling it this winter. Heather Malloy knows the pain of sinusitis.
I woke up with a sinus headache every day, and I had an unbelievable amount of eye swelling. I looked like a frog usually in the morning.
Heather is not alone. Studies show nearly 40% of people with sinusitis fail first-line treatment with antibiotics, decongestants, and nasal sprays. Dr. Jordan Josephson, a sinus specialist at Lenox Hill Hospital, sees many of these cases.
If they're still not getting better, then we try to up the regimen and we try to add more and stronger antibiotics.
That's just what mountain climber and ear, nose, and throat surgeon Dr. Paul Obert was faced with when he was at the base camp at Mount Everest.
That sort of thing is going to end your trip. You're working on such a thin margin at that altitude, even at base camp. So when this happened, it got my attention.
Dr. Obert didn't take any chances and went with a broad-spectrum antibiotic called Avalox to knock out the infection.
Your body's immune system is stressed. You're working very hard physically, and the air is very dry and cold, and your voice, your lungs, everything stays irritated.
Dr. Obert was climbing under severe conditions. Fortunately, he recovered and reached the summit. But the cold weather we're having now could also aggravate your sinuses.
We know that right now the flu is just antagonizing a lot of folks, and those folks are feeling it in their sinuses in addition to the rest of their body.
Although most get better with medication, for some, surgery is the only answer.
For those people that have very narrow passageways, surgery works quite well.
Heather had multiple surgeries, but was still feeling the pain.
Huge chunks of my life were taken up with treating sinus pain and cold compresses and steam baths, just trying to manage how I felt on a day-to-day basis.
Until a recent surgery finally gave her relief.
I had sinus surgery on Friday, and I feel like I have maybe a very minor head cold, but I'm not in pain, and the swelling is better now than it was the day before the surgery.
Dr. Josephson says it's not uncommon for patients who've had sinus surgery in the past to require a second operation, but he says newer techniques offer patients a better chance for a cure. Back to you.
Hollywood hits Times Square.